Hello and welcome to TALRadio. At TAL, we connect those who are willing to give to those who are in need. And giving is something which is not in everybody's hand. It's not an easy thing. It's a very special episode today, and I'm very delighted that I'm joined by Somnath Chatterjee, a name that actually resonates with TAL Radio. He's not new to TAL Radio, and I'm sure the audience and our lovely listeners do know him. But today, he's come up with something very interesting. So, without further ado, let me introduce you to Somnath Chatterjee, who is the co founder of CWC, that is Crack the Wellness Code. Somnathji, welcome to TAL Radio.
Thank you, Shanghamitra. It's a pleasure to be in TALRadio once again. And
Thanks a
yeah, there's
lot.
lots going on in CWC. So let me start with some updates and then tell you this unique program that we are doing on February 20th and how we would like to engage the community with that. So Crack the Wellness Code, as you know, started in 2018, July. And then we've come a long way, in more than 220 events. And we have developed a very vibrant and dynamic ecosystem of doctors and service providers, health heroes, a whole bunch of wellness champions, coaches. So all of them have remained with us, and together we bring out a lot of events on site and online. We have created a content repository which is very personalized to the community. So we have community tracks which are for women, elders, and youth. We cover a whole bunch of ailments, but more specifically, we focus on heart health, cancer, behavioral health, and of course, diabetes and metabolic health. We have a digital marketplace where we offer a bunch of products and services, which are sometimes preventive in nature and sometimes they're therapeutic in nature through third-party arrangements. So that's basically, brings forth a whole bunch of services and resources and content for the community. And our focus has been entirely on mind-body wellness. We obviously are very conscious that the mind and body are absolutely interrelated, and in holistic medicine and the emerging trends, your mental situation is something that always go with your physical situation. It has always been there, but now more deeply understood and more extensively, I would say, taken care of when this in the healthcare system. So that's basically what we do. And as I said, preventive care is a very important aspect of CWC, and also managing best practices, taking the best from West and East. We are headquartered in Silicon Valley, San Francisco Bay Area, and we also have a chapter in India, and we'll also be spreading to other locations. So that's very briefly what the journey of CWC has been.
Lovely to know that. In fact, when you were talking about so many events and so many services, I believe the biggest talk of the town, at least as we are talking at the moment, is about the upcoming event on nursing services. Could you just elaborate why this event, why should people participate, and why they are looking forward? In fact, the whole city is actually looking forward to this event. And when is this event happening?
Yeah, so this event is happening on February 20th, this Thursday, from 6 to 7:30 Pacific time. And the registration link is a bit.ly, which we'll be giving in this session so that you can just join, register. In case there's a schedule conflict, please register, because if you register, we'll give you a free video, which is nicely captioned, edited. So don't miss it. But let me tell you what it is all about. Now, we all know about nurses. I mean, they're unsung heroes and doing wonderful job for the society. Who can forget the kind of activities and kind of dedication of nurses during the pandemic, for instance, right? But things don't begin or end with pandemic. They have been there for us all the time, and this is going to be
True. In fact, if you remember, there's a very, sorry to interrupt, but there's a very beautiful
sure.
movie, when you talked about, nursing services, Pearl Harbor, if you remember that movie. It was a huge, amazing amalgamation of emotion and especially beautifully displayed by the nurses who were taking care of those wounded soldiers in World War II. So yeah, so it's a very, very long history, and as you said, they're very unsung heroes, and you're doing something for them. So yes, let's take it forward.
Absolutely. See, things have also evolved on the nursing services arena. I mean, nurses are not just serving or just looking after you. They also do a huge review work. They look at the entire chain of healthcare services, from end to finish, right? And at the same time, they also do huge administrative work. There are nursing services, and there are nurses who are PhD in top business school. I know so many nurses who are MBA from top business schools in the world, right? And those are the kind of people we work with CWC. Okay, so I'm very delighted to tell you that we have partnered with an organization called BINA, which is the Bay Area Nurses Network, and they also are affiliated to the Pan US Nurses Network. So through them, we are actually going to be working with nurses all over USA and in the Bay Area. And since we have a chapter in India, we are also trying to do similar things in India as well, right? Now, coming back to the event, see, we are going to talk about some very specific things that people do not know about nursing services. I mean, let's hope that you don't have to really get to a nurse, the need of a nurse, but we all need. There are situations, and we're talking about preventive care. So there are a lot of areas where nurses can help you to make sure that you do the preventive care in a manner which prevents you from going to the hospital again and again, or getting or falling sick again and again, right? So that's an area where nurses also play a very important role, and we are going to tell you that. We're also going to tell you about emotional wellness. Lot of your health problem gets mitigated, if the emotional wellness is taken care of, and nurses play a very important role. I think that's something which comes very naturally to us, because that they are, the second home for you. If you get a good nurse, and the nursing services are good, where your medications that you forget are taken care of, and all the other things that go, the entire paraphernalia, particularly in case of chronic diseases, elderly patients. This event is happening as part of the Track the Wellness Code Elder Track. But at the same time, anybody and everybody can attend this event. But for elders in particular, we are bringing this event because they ought to know a lot about what nursing services they can get, what is available, and how best to leverage that. And that's what we are going to present on February 20th.
So, what would be the biggest takeaways from this event for the people who are attending it, or probably people who would be, willing to attend it and really looking forward to attend it?
Yeah, so the biggest takeaway would be to understand how the nursing services work once they get into a healthcare system environment, whether it is a short-term stay in a hospital or a healthcare uh, or engagement with a healthcare provider. And at the same time, there are people who might be looking nursing services at home. Okay, so how this whole nursing services work, and how best to make use of it and benefit from it, because knowing is also very important to ensure that you get the best of what is available. That's one, and we have those wonderful dedicated nurses. There's two nurses are going to actually come. One is also dealing with infectious diseases. So there are very specialized nursing services. So it's not just nurses also specialized, and infectious disease, not just because of the pandemic, but in general, every season there is something or other going on, right? So we'll also talk about nursing service in the infectious disease area, right? And how to take care if you find that you're infected. Okay, then emotional wellness, right? So I would say this would actually open up a lot of unknown factors for the community, which will help them to actually mitigate problems when they fall sick, and also make sure how best to leverage the facilities that are available and the care that the nurses provide. So that's the biggest takeaway. And the other thing I wanted to add besides that is, once people attend this session, it's an online session, 90-minute session with two nurses, and we'll also have some question answers, interaction, etc. So obviously they get to know about the services available, and also the opportunity to interact with the nurses. That is definitely a very important takeaway. But post-event, we are also going to offer nursing services in our digital marketplace. So we have an app called CWC Kushi app, and also web platform through which you can go to the marketplace and you can actually find nurses, and there are a lot of nurses which are available, uh, who are available for accessing their services, and particularly for elders and people who are chronically ill, or any other terminal diseases. This could be a very important service that we are providing. So that's basically, in a nutshell, what they can expect, what they can get. And CWC, we provide wellness as a journey. So, I would say with this event, your journey with nurses start, whether you are your loving ones have the situation where you need that service. We are here to help.
All right. And when we're just mentioning about all the highlights, the key pointers, and that people can take away from this particular webinar, this web event, I was really wondering, is this like age specific in the sense like you would be providing nursing services, or this event would be catering to needs of elderly people or mid-age, or it could be for the kids also, because nursing services could be applied or could be used by anybody and anybody who's in distress or is suffering from a certain ailment and has nobody to take care of them at home.
Yeah. So obviously, it will start in a very generic plane where we talk about what it is all about, what you need to know, etc. Then we would focus on the elders, because they need this service more. They feel very helpless, and particularly on the emotional plane. So this is part of a CWC elderly track, but we are orienting this program in such a way that we also cover some very important generic aspects of nursing services. And also, you see, apart from the nurses talking about making presentations and so on, we'll also have question answer session and interaction. So all are welcome, and that is where you can actually find things for yourselves, right? Even if you're a mid-age professional, busy, and you have somebody chronically ill at your place, what is it that you should know and what that should do. And also the fact that unfortunately there are so many people, so many families which have uh, kids and youth who are either autoimmune, or they have autism,
True.
or other kind of terminal illnesses, or chronic illness, and they definitely can benefit from this program, other than just the elders. And we are open to answering their questions. So we have kept a lot of window for such possibilities during the program. Yeah, and make it interactive.
Amazing.
Yeah.
Amazing. And Somnath, could you also elaborate something that I was really intrigued by? Like, would it be like the nurses who would be a panelist who would be speaking on this event, on this webinar, would they even discuss something like maybe some preventive measures? Like, for example, if you're alone at home and something happens, like, is there something that kind of an interaction also going to happen?
Absolutely, absolutely. So let me tell you, the format is that they'll make presentations, which is very generic, which everybody should know, and they'll talk about certain things specific to the elders. For example, how to avoid a fall, right?
True.
Okay, okay. We also deal with motion sickness, vertigo, etc., etc. One of the biggest thing that happens is a fall that triggers to many other things, and then
Yes.
if you have something else, they'll talk about patients with comorbidity, right? That's a very important area, patients with comorbidity, how to deal with that. So I would say that there are a lot of these particularly patients who have comorbidity, what kind of prevention they should take, right? So nurses not only will guide in terms of the preventives, but also in terms of reviewing. They do the review, and the way they do the review, you also get to understand, how you should actually assess your own self. At the end of the day, what CWC does is to help you to take charge of your health. So a nurse can actually guide you to take charge of your health, because nobody can do better than yourself. Because if you can control your mind and body, then obviously you're in better command. Of course, there are other enablers and facilitators like the nurses. So they're also trying to help you in taking charge of your health.
All right. And is there any eligibility criteria to participate in this program? Like you could be anybody, and from anywhere you could
It's
register
a free
yourself?
program. Yeah, it's a free program, and we are a 501(c)(3) nonprofit. And our job is to reach out to as many people worldwide. We are based in Silicon Valley, and we also have a mobile app. So through that, we disseminate thousands of videos, podcasts, and so on. So we'd encourage people to become members. So this event is for newcomers. This event is only a beginning. Uh, do become member through the Kushi app, CWC Kushi app, and at the same time, this is I would say an event which will definitely create a dent in terms of an area which not people do not know. And I would say that through this event, we're also kind of reaching out to people at different demographics, different geographies. And even if you're not able to attend the event, do register to get a free edited caption video. And the video will also be there for our members, so they can also access it. So yeah, so the whole idea is to make it accessible to people even the post event, and reach out to as many people as possible. Yeah.
Lovely. So, all my dear listeners and our lovely audience, if you're looking forward to join this wonderful webinar on nursing services presented by CWC, then click on the link below that you see on the screen, or you are, if you're listening to us, and I'm sure somewhere you would be able to see the link, and probably you can just click on it and just register yourself for this upcoming webinar on nursing services, which is going to be held on 20th of
Yes, nursing services, what you ought to know.
nursing
That's the
services.
theme, and I'm sure it will cover a lot of unanswered questions so far that the community need to know.
And before I let you go, Somnath, I would really like to know, are there any post services also? Like, for example, people who miss on this event, they certainly, even if they have registered, they get the edited copies of the webinar. But any kind of post services that you will be able to provide post this event if somebody wants to get in touch and
Yeah,
have an
so the
interactive
good thing
session?
is that CWC provides wellness on the go. So we have a mobile app called CWC Kushi, KHUSHI, which is downloadable from both the App Store and the Android and the Google Store. And you can also uh, become a free member and access tons of videos, not only this, but so many others. And some of them are very personalized. As I said, we have a specific for women, elders, youth, professionals, and at the same time, we do a lot of events. So in the future events, a lot of on-site events. So it's a journey. We so if you become part of CWC, become a member, you become a part of it's your own wellness journey, because it's an ongoing thing, and we do the whole unfolding all the way, help you to connect with doctors, service providers, and all our ecosystem members. Yeah.
That is so lovely. And I would say so kind of you to take this initiative and really invite all the people across the globe to participate for this wonderful event. So, people, please, if you're listening or watching to us right now, this is the link. Just click on it and you are good to go for a new journey. Thank you so much.
Thank you.
And thanks a lot for joining us on Tal Radio. Thank you so
Bye.
much. And by the way, I really have to remind our audience also that CWC and Tal have been together for quite some time. And we really appreciate the kind of support that we get from CWC. Thank you so much for that.